this video, we will be discussing the instruments which are used in septoplasty and nasal fracture repair. This video is made under the guidance of Dr. Tarun Ojha sir, Professor and Head of Department of ENT and Head and Neck Surgery, Mahatma Gandhi Medical College and Hospital, Jaipur. Before we proceed with the video, you should know some important points regarding the exam. In your practical exams, when you are asked about any instrument, the examiner can ask anything related to the particular instrument. For example, if you get a gouge and hammer, after identification of the instrument, the examiner can ask anything about the septoplasty procedure, the indications, the contraindications, the complications of septoplasty, the diseases related to septum like DNS, types of DNS, and also about the normal anatomy and functions of the nasal septum. With the first instrument is Thaddekum's nasal speculum. It has a U holding part with two long-standing blades. The method of holding this instrument is we place our middle finger and the ring finger along the sides of the blade, and we take the index finger to give support to the U holding part. We press our middle and the ring finger together and insert the speculum into the nasal cavity of the patient. We then gently release our middle and the ring fingers in order to open the blades, which makes us easier to view the nasal cavity of the patient. This speculum is used in anterior rhinoscopy, and it is used to observe the nasal septum, the Little's area, the lateral wall of the nose, the floor of the nose. For therapeutic purposes, it can be used for the removal of foreign bodies, antral wash, and for the initial steps of polypectomy and septoplasty. This is a similar instrument which is a St. Clair Thompson's nasal speculum. This also has a U holding part and longer blades. Coming to the next instrument, we have Tilley's nasal dressing forceps. It has two ring-shaped finger grips which are used to grip the instrument. We place our thumb in one ring and our ring finger in the other, and we give support here on this blade with the middle finger. Then this has a bend, and this bend is basically to provide the surgeon a complete view of the nasal cavity even after inserting the instrument. The uses for this forceps are, it is used for the nasal packing, for removal of foreign bodies, and for inserting the cotton during the surgery. Coming to the next instrument, we have the Frere's elevator. This elevator has a long slender instrument with central holding part with two curved flat ends. The uses are, it is used for the elevation of the mucoperichondrial flap in septoplasty. Next, we have the nasal gouge. These are the two types of gouge. This has two ends. One is the grooved cutting edge and the other is a flat end. The difference between these two gouge are, this is a fishtail gouge and this is a normal gouge, the straight one. Then we have a mallet, or also known as the Heerman's mallet. This is used to put pressure on the gouge by hammering it like this, and this is used to remove the spur in septoplasty. The next instrument is Lempert's nasal suction cannula. This is used to do suction in the nasal cavity during the surgery. We have different number of the Lempert suction. This is a 3-number Lempert suction which is commonly used. Next, we have the Ash and the Welsham's forceps, which are basically used to treat the nasal fractures. This is an Ash forceps which is used to reduce the septum and to treat the nasal septal fracture. Here in the Ash forceps, both the ends are curved and it is placed inside the nasal cavity with septum in between the blades, and then the blades are approximated in order to bring the septum to back into the shape. This is a Welsham's forceps which has one serrated end and one smooth end. This serrated end has a rubber cork which is fixed into the end. The rubber cork is fixed in order to prevent serrations or damage to the skin. Here we take the forceps. This part of the forceps is placed inside the nasal cavity, whereas this rubber corked part is placed outside the nasal cavity, and this cork, it prevents serrations or damage to the skin. This is placed in the nasal cavity, and then it is helped to correct the nasal fracture. So this was a video which was regarding the instruments which were used in septoplasty and for the nasal fracture repair. For Viva point of view, you also have to know the indications for the septoplasty, the complications for septoplasty, the brief procedure of septoplasty. Also, you should know the indications for nasal fracture repair, the duration, and the complications for nasal fracture repair. Thank you.